Good afternoon, this is Cindy Baddeloo, Chief Operating Officer here at the Iowa Healthcare Association. I have a quick video update for September for you, covering some key regulatory issues, some association information, as well as the annual convention that's coming up the end of this month. It's been a busy month for completion of projects. We are working on completing 30 legislative forms around the state, ending culmination with our convention the end of this month. Reminder, the IHCA convention is coming up in less than 2 weeks. Download the convention mobile app now for your iPhone or your Android device. Social media campaign. We have the release of our new workforce social media campaign that has started. There are a number of ads running across multiple social media platforms. Are targeting prospective employees for long-term care, going out on like Facebook, Twitter, other social media accounts. We encourage you to access these tools from our website, to incorporate those into your website and your Facebook messaging to help make the campaign work best for our members, and encourage you to post these videos. They are out on our website homepage under the news section. There's a section about launching our workforce social media campaign where you can get a hold of those. Also along the lines of workforce, we just published our updated comparison for cost, wage, and staffing data. This data comes from the nursing facility cost reports, the Schedule H. What we've done with that analysis is enable you to do some benchmarking, not only for nursing facilities, but assisted living and home health, looking at the different peer groups, so you can do some comparison with yourself for small rural areas, large urban area facilities, as well as urban, large and small. There was some highlights of note in there, as of course I don't think it's a surprise that we haven't had demonstrated the highest level temp staffing this year. And also our average hourly wages increased over the state about 3.5%. These can be found on our website under members only. Log in there, and then under the workforce tab, there's information under news and resources there for you on that area. Some of the regulatory highlights, starting out with nursing facilities. This month there's a new PBJ report available called the Job Title Report. I encourage you to utilize that with your CASPER report to check the accuracy of your PBJ submissions. As you know, you also have 7 days in a quarter. Without RN coverage, it can take you down to a 1-star. So we really encourage you to take a look at those couple reports before, as you're submitting your PBJ, and make sure they're accurate. Also starting October 1st for skilled nursing facilities, the Medicare rates will be adjusted based on past performance on rehospitalization rates, and that could be up to a 2% withhold. So if you want to know how that will impact your facility, go ahead and look at your long-term care trend tracker reports. There is a item called the SNF VBP predictor tool, and you can take a look at how that will impact your facility. We will be beginning the PDPM. We use a lot of acronyms. A 4-hour intensive training starts first at IHCA's National Convention in San Diego on Sunday in October. Following that, we will be doing an intensive training here at Iowa Healthcare Association in Des Moines on December 12th. So mark that on your calendar for staff on understanding that new system, because that will affect your skilled nursing facilities. We will be having some of the same trainers that IHCA is having at their national convention. For assisted living, 2 items I wanted to make sure you knew about. This Thursday, September 20th, or if you're watching this after September 20th, you can download the recording of it, is the compliance webinar for assisted living. While many of you don't participate in the Medicaid or Medicare program, you do a lot of referrals and work with hospice, home health physicians, and hospitals. So you need to be aware of the anti-kickback, conflict of interest, fraud, and abuse laws. And this webinar can help give you an overview of the situations that can arise for assisted living providers and help you with your compliance programs. And that webinar is at no cost to all ICAL members. Also, while you're out there on the website looking for this on ncal.org, is the AL Cost Calculator. It's a web-based tool that can help you allocate resources, look at how much cost there are for your resources for your residents. Looking at allocates monthly costs across the community. If you're a multi-facility, you can compare costs across companies over time. Compares between unlicensed and licensed staff, type of care. It gets into a lot of detail that can help your assisted living community. Also, if you're a Medicaid provider, it helps educate Medicaid providers on their assisted living costs. So take a look at that. For our home health providers, the new conditions of participation interpretive guidelines came out in the end of August. Those were effective, of course, back in January, but the new guidelines came out a few weeks ago. So we'll have a session at our state convention, both with Annette Lee from Provider Insights and also a session with the Department of Inspection and Appeals on that topic. But I would encourage you also, the National Association of Home Care and Hospice, who we are the state affiliate for here in Iowa, is doing a webinar from their experts on that on September 20th as well, to talk about and help you get ready for your staff to be ready to be in compliance with that. Thank you and for participating in this short video association message, and we will have another one in mid to late October. See you then. Thanks.